Our colleagues, today we've heard about the different activities that are taking place on a global level in One Health, and also the activities that are at national taking place. Now, mine will be to just demonstrate some of the activities that we are facilitating at community level as the University of Pretoria and Future Africa. Now, I'll start off with the definition of One Health as published by the One Health High Level Expert Panel through the advisory role to the quadripartite organizations. Now, in addition to talking about the optimization of the health of people, animals, and ecosystem, this definition makes mention of the mobilization of multiple sectors, disciplines, and more importantly, communities at variable levels of society. And communities are brought in or emphasized in this instance because we are custodians of the environment. And more often than not, we find that communities are vulnerable to zoonotic diseases, pressures from the environment in terms of food security, extreme climate events, access to clean water, and also energy. Now, in addressing these health threats or these health challenges and also implementing One Health solutions, we need to be guided by One Health pillars that have been published in the One Health Joint Plan of Action. And these include communication and collaboration between the different stakeholders, be it the state, the NGOs involved, focus groups at community level, the research sector, and also the private sector need to come in this instance. And this really helps to create an environment where there is a co-design and co-development of activities to address existing challenges. And these activities need to be coordinated at the different levels. And parallel to that, there needs to be a capacity development, whether it's the strengthening of existing capacity or development of new capacities to address challenges. And we need to be guided by principles of One Health, and these include shared responsibility and partnership between stakeholders, having gender equality where everyone feels that they can be involved in the process, and that environment of equality is created, and there's inclusivity as well, and equity. And this really helps us to recognize that outside of animal, human, and environmental health, there's also a need to address other socioeconomic challenges within the community, be it in education or youth and women unemployment and other inequalities. Now, as the Future Africa, we are a platform that promotes collaborative transdisciplinary research and work together with the sciences and link them to society in order to address Africa's most pressing challenges. And we are under the leadership of Dr. Heidi Heckman. Now, these challenges are addressed through the different challenge domains we have, and one of those is the Future Africa Research Chair on People, Health, and Places, or in short, can be called the One Health Research Chair. That is under the leadership of Professor Vanda Makwaka. Now, the Future Africa One Health Research Chair really expands and supports transdisciplinary research in One Health across the different faculties and between institutions at country and continent level, and also supports capacity building opportunities and mentorship, and mobilizes the resources needed to support all these activities. And community engagement is an important aspect of that. Now, what can One Health look like on the ground? Now, as the University of Pretoria, we engage in several activities for the promotion of One Health across the country. And one such example is the NISI One Health platform. Now, this platform really, I'll start off by just saying that it's located at the community of Aikenhoek and Hluvukani that are near the open gate at Kruger National Park. And this form part of the greater Bushbuck Ridge region. Now, what makes this quite an interesting platform is that there's so many stakeholders that come in order to strengthen the platform itself. And an important part of that is the role that the University of Pretoria is playing, in that it brings in the Hanso Heisen Wildlife Research Station that offers a training platform and also infrastructure for veterinary students to come in and get their research training through world-class labs and animal holding facilities. And those skills are now translated into community service through the MNISI community program, where students are taken into the community to serve and offer animal health care services to the community. And the community also has, fortunately, an animal health clinic to offer animal health care services to the community at a low cost. And more recently, there's an environmental platform that's been formed in the community where people are trained to become environmental monitors. And the most recent project that they've been involved in is the disposable nappy project, where they're looking at that challenge within the community. So it's quite interesting to see that the environmental aspect, which has been much neglected in the One Health conversation, is now being brought into the fore. And another example that we are involved in terms of One Health is in the rural community of Amafefe. Once again, the example is a rural community and it involves livestock health as well. And really, it's not surprising that livestock health forms many of these conversations, because livestock does form the main economic activity in rural communities in South Africa and also across the continent. And a threat to livestock health can translate to a threat to human health if the disease is zoonotic, and also can threaten environmental health through the disposal of carcasses. Now, in this example of Ramafefe, we found that the livestock had a high tick load, and when conversing with the local community, I also brought the local state vet and also the provincial animal director into the conversation, where we sat people down and then we understood what the problem was, because the state does offer regular tipping services to the community for free because they're mandated to do so. But then we found that due to breakdown in communication, the lack of skills to identify or detect any issues with animals, and also the lack of awareness of the importance of regular dipping, the dangers of not dipping, and how that can threaten human health going forward and environmental health going forward, was really highlighted. But the important thing that came out of this was that we saw the need for skills training opportunity for the communities and the community there. And indeed, we implemented that through a workshop where community members were invited that own livestock, and those, even those that didn't own livestock, and the local state technicians, vet technicians, were also invited, and the expert shared or imparted knowledge and skills to the community. And we continue to support the community in this regard by implementing recommendations by the expert that was brought in, any recommendations by the community and the state. And in future, we look forward to giving advanced training to some earmarked individuals in the community in order to create that capacity or that skills capacity of animal health care in that community. Now, what we envision in One Health going forward is a scenario where we have an animal health technician, environmental monitor, and a community healthcare worker at the community level. And they will really be collecting data and putting it into a single data platform where, at a higher level, the research technicians, the researchers and technicians, and also the state come in to analyze the data and interpret it and come up with solutions that are referred back to the community for implementation. And I always say that, or I'm of the opinion that any interaction with the community should also be used as an opportunity to impart One Health knowledge in order to create awareness and also bridge knowledge gaps in the community. And we've done this as the University of Pretoria through our various collaborations with different stakeholders, whether be it to develop educational material or to distribute existing material. And we also see the importance of having this material translated in local languages in order to promote understanding and a change in attitude towards the environment to protect human health, to safeguard human health, and also protect animal health and environmental health as well. And examples of this is the Living Safely with Pets book, which has been translated into Sepedi, isiXhosa, and isiZulu. And there's also the Want a Friend, Be a Friend book that's been translated into several languages as well, and various educational posters that have been distributed in abattoirs and communities across the country. And this material is available not only through physically but also through our various website platforms, and it's freely available as well. So, colleagues, I think that is my time. Thank you so much.